So marijuana has a lot of different components in it. There's upwards of 100 different types of THC within marijuana plants. And so the THC, or the tetrahydrocannabinol, is what actually has the euphoria effect, or the psychogenic effect that causes people to get quote-unquote high and have that feeling of euphoria. Whereas cannabinol has more of the medicinal effects of what people try to use for benefit in medical uses, but it does not have the euphoria effects or the psychogenic effects that the THC has. So the medicinal uses for cannabis and its derivatives, originally it was really synthesized and utilized for appetite stimulation in patients with HIV and AIDS, and then also to help with nausea and vomiting associated with chemotherapy related problems in patients with cancer. Since then, it's continued to kind of be utilized, for example, for neurologic type disorders that don't respond to typical therapies. But again, there's not a lot of good hard scientific evidence related to those things. One of the other problems associated with the whole medical marijuana situation is naturally occurring marijuana has maybe upwards of 15 to 20% of the THC component, whereas some of the more genetically engineered synthetic products contain upwards of 30 to 33% of the psychogenic THC, which again, predictability of how somebody is going to respond to this is highly variable. As far as the safety aspect of medical marijuana, certainly in the state of Colorado there have been numerous reports of the safety concerns related to medical marijuana. In fact, one of the big problems that has been documented is the increased number of fatal vehicle accidents due to impairment from utilizing recreational marijuana. Some of the dangers associated with marijuana, obviously if it's smoked, then there's obviously all the smoking risks associated with, very similar to smoking tobacco. So those are all very, very concerning for long-term use. Another big safety concern is the fact that not only is there inhaled or smoked marijuana, but there are also consumable products that can be taken by mouth. From all kinds of things, from candies to baked goods and et cetera. And big concern there would be children and adolescents getting access to those types of products and having just really detrimental effects on them. So advice for patients who might be needing to have use of legalized types of obviously allowed by law in the state of South Dakota, I would advise them to see a physician who's caring for them and describe their problems. If it's related to chemotherapy, nausea and vomiting, then certainly they can see the physicians caring for them in that regard, and those things can be done through a prescription. For me as a pharmacist, first and foremost, I don't want to cause any harm to anybody, and so that is my concern related to some of those things that people are trying to push for to get legalized. Is we just don't know long-term safety and the long-term potential negative health impacts of some of these things. And as I said, we've certainly seen some things coming out of Colorado where there have been some bad things occurring related to some bad outcomes.